Hello everyone. So today we'll be discussing one important topic of community medicine and also pediatrics, that is National Immunization Schedule. National Immunization Schedule. So what are the vaccines that are to be given in the National Immunization Schedule? That will be discussed today in this lecture. So at birth there are three vaccines which are to be given: BCG, OPV 0 dose and hepatitis B birth dose. These are to be given, this hepatitis B is to be given within 24 hours of birth. Next is at 6 weeks, 10 weeks and 14 weeks. Okay. So at 6 weeks, 10 weeks and 14 weeks, OPV1, OPV2, OPV3, along with that pentavalent 1, pentavalent 2 and pentavalent 3. Rota 1, Rota 2, Rota 3. Fractional IPV 2 doses are given at 6 and 14 weeks. Then PCB1 and PCB2 is given at 6 and 14 weeks. So this schedule, Rota, IPV and PCV, these are given in some selected states. Otherwise, in all other states, the OPV 1, 2 and 3 as well as pentavalent 1, 2 and 3 are given. This RIP, that is Rota, IPV and PCB, these three are given in selected states. Next, coming to at 9 months. At 9 months, measles first dose or MR first dose, that is measles and rubella first dose is given. Vitamin A is given. Japanese encephalitis first dose is given. PCB-B is given and IPV third dose is given. Then 16 to 24 months, DPT first dose booster, OPB booster dose and measles second dose or MR second dose is given. Along with that, Japanese encephalitis 2 is given. This Japanese encephalitis, wherever it is given in endemic states. Okay, at 9 months and in between 16 to 24 months. So there are two doses of measles and rubella, that is MR1 and MR2. MR1 is given at 9 months, MR2 is given at 16 to 24 months. Then at 5 to 6 years, DPT second booster dose is given. 10 to 16 years, TD is given. So earlier it was TT, now tetanus toxoid, now it has changed to TD, that is tetanus and diphtheria. So for pregnant women, what are the doses? So for pregnant women, TD1 is given early in pregnancy. Then TD2 is given after 4 weeks of TD1. Now TD booster is given if pregnancy occur within 3 years of last pregnancy. And if 2 doses of TD was given in last pregnancy. Okay, so this was all about your national immunization schedule. So in this, what are the things which we need to remember is that at birth 3 vaccines are to be given, that is BCG, OPV and hepatitis B. Apart from that, 6, 10, 14 week OPV1, OPV2, OPV3 along with Penta 1, Penta 2 and Penta 3 is given. Then RIP vaccines, that is Rota, IPV and PCB. These are given in selected states. So Rota there are 3 doses, whereas IPV and PCB there are 2 doses. Then at 9 months there is MR1, vitamin A, Japanese encephalitis in endemic states, PCB booster dose, IPB third dose. Okay. At 16 to 24 months there is DPT first dose booster, OPV booster dose, then MR2 and Japanese encephalitis 2 in endemic states. In 5 to 6 years, DPT second dose booster is given. So there are 2 doses of booster of DPT. Then at 10 to 16 years, TD is given. For pregnant women, there are 2 doses of TD, that is tetanus and diphtheria. First in early in pregnancy and second is after 4 weeks of giving TD1. Then TD booster dose is given if a woman become pregnant within 3 years of the last pregnancy, and if in the last pregnancy 2 doses of TD was given. Now coming to what are the constituents of penta vaccines. So penta vaccines, pentavalent vaccine, it contains DPT as we all know, that is diphtheria, pertussis and tetanus. Along with that it contains hepatitis B and HIB, Haemophilus influenzae B. So this is another question. So that's all about national immunization schedule and what are the different vaccines which are given in the national immunization schedule.